Hi everyone, my name is David Bartka and I work for Eduto Healthcare, who's an Australian full-service consultancy company, and our name means helper in Latin. Let me give you today a high-level overview of the medical device registration process in Australia. So this talk is divided into 6 sections, starting from the regulatory basics, then we'll head to the registration process and timelines, the potential impact on your global strategy, and 2 case studies. So first, let's start with the Australian regulatory framework and environment. So in Australia, the medical devices are regulated by the Federal Health Agency, which looks after all kinds of therapeutic goods. This is called the Therapeutic Goods Administration, or the TGA. The legal framework is the Therapeutic Goods Acts 1989 and also the Medical Devices Regulation 2002. Additional legal requirements are often communicated by the TGA via the therapeutic goods orders, determinations, and instruments. These provide further clarifications on, for example, excluded or exempt medical devices. Now, let's move on to some basic terms and definitions. So the most used terms and definitions are listed here and also on the next slide. I'm not going to go into the details because the aim of these 2 slides was just to provide you with a single source of reference, as the slide deck will be available online for later. In general, we always recommend, however, that reviewing the definitions of the medical device, software as medical device, or kind of medical device, a combination product, and also the manufacturer, or in some countries, legal manufacturer, in each target country, because country-specific differences may occur. And we can just move to a more specific information slide on softwares as medical device. Now, I understand that some of you in the audience may be interested in softwares. So let me show you this TGA roadmap. And you can see the source and additional information in the footnote. The aim of this roadmap is to clarify as to whether your software is classified as medical device in Australia, and if so, can it be considered as an exempt or an excluded device? In general, excluded products are grouped into 5 categories. One is the consumer health products, or in other terms, the wellness products. The other is enabling technology, like telehealth or remote diagnosis. Another is digitalization of records, but others also include analytics and laboratory information management system. And let's move on to the registration process and timelines. You will see probably a lot of information on this slide. Let me walk you through what you can see here. So you will see the main steps of the registration process here, just the same as you would do in Europe. It starts with the determination if your product is classified as a device, and also the applicable device risk category. Now, why is this important? It's exactly the same reasons why it's important in Europe, because the device risk category is directly proportional to the level of evidence that is required, and it also impacts the clinical and registration strategy. As you would assume, the device risk category may differ among countries and may also change over time. In the next step, you establish your supply chain model and identify the legal manufacturer who will be responsible for the product, and also start working on the QMS system to comply with the international standard ISO 13485. At this stage, you also start generating technical evidence to demonstrate that the product is safe and it performs as intended. Next, a conformity assessment application is submitted. This can be either to a notified body, similar to Europe, or a regulator like the TGA. After you receive approval for the conformity assessment, the remainder steps are usually administrative processes. In terms of timelines, the time frame for a device registration in Australia, you will see on this slide, can vary greatly. It depends on the type of overseas evidence and the device risk category, among others. Regarding the conformity assessment application, the TGA target timeframes is actually 1 year, but they used to use 255 working days. This step is not applicable if the product has a CE mark or the lowest risk class 1 device. The next step is the manufacturer's evidence. This is a minor administrative process, usually completed within a couple of weeks. And similar to the previous one, it is not required for class 1 devices. And last is the device registration step. So after this process, you will be able to start marketing or launching the product. This step usually takes around 1 month and is administrative in nature unless the product is selected for a TGA application audit. Now, some devices must undergo a mandatory TGA audit. For example, the highest risk class 3 devices or class 4 IVDs, but also IVDs for self-testing. Any other medical device can be selected, however, at the TGA's discretion. If selected, the TGA reviews the technical documentation and also any conformity assessment evidence. They do have target processing timeframes, which can be between 30 and 60 days, depending on the level of the review. 60 days, of course, stands for the more in-depth audit. Unfortunately, though, due to TGA backlogs, the actual process may take much longer. And in our experience, this step can take up to 1 year, which is, of course, first case scenario. Now, what if your product has overseas approval? So as mentioned in the previous slides, all devices require conformity assessment evidence except the lowest risk class 1. The good news is that you can leverage the CE mark or CE certificate you may have in lieu of a TGA conformity assessment. This can save you a significant amount of time and money. Some common examples are listed on this slide. Most importantly, you can still use the current EC certificate issued under the previous EU MDD with extended validity. But if you have the more recent or the current European MDR certificate, then the process may be even quicker and less expensive. A comprehensive list of acceptable overseas evidence is provided in the TGA document in the footnote. Definitely worth having a look because you can leverage Singapore, US, Canada, Japan, and other overseas evidences. Now, if we move on, how does an Australian registration impact on your global strategy? So we know that there is no generic regulatory strategy that fits all device categories and markets. We wish there would be one. There are so many aspects to consider, like competitor landscape, supply chain model, or in specific, which entity will be considered as a legal manufacturer, what QMS or conformity assessment evidence do they have, and the requirements, the regulatory requirements of the target markets. And the list goes on. So any device other than class 1, as mentioned, does need evidence. Now, although there is not a single type of evidence that is accepted globally, but there are really good and valuable reliance programs that actually you can use to your advantage. Historically, companies used to leverage the CE mark, but now the reliance on the US FDA approval or the MDSAP pathways are getting more and more attractive. A growing number of companies with no CE marks are nowadays considering MDSAP. MDSAP stands for the Medical Device Single Audit Program. That is acceptable in US, Canada, Japan, Brazil, and Australia. And the observer countries are all over the world, and their numbers are growing. Now, this is a fast and cost-effective alternative to CE mark outside Europe. Certificate can be issued actually by the notified bodies, the same notified bodies who you would usually issue CE certification, but they can also be issued by health agencies. All right, so let's move on to the case studies. Let me walk you through two studies. The first one will be an overseas manufacturer who wanted to register their device in Australia, leveraging their CE certificate under the old or the previous EU MDD with extended validity. First, we determined the Australian device risk category and also confirmed that their overseas CE certificate was indeed acceptable in Australia. We worked with a local Australian entity, which is known as the sponsor, who is responsible for the product registration. We established the necessary procedures to comply with the TGA requirement. And as part of that, we facilitated the execution of the quality agreements between the sponsor and the manufacturer. Afterwards, we created Australian-specific labeling and promotional materials and prepared and submitted the applications to the TGA. The approval was granted within a month. The other case study is about an Australian manufacturer who had a Class 2B device under development. We worked with the manufacturer to develop global registration strategy to cover several Tier 1 markets. The MDSAP certificate or pathway was selected as the main conformity assessment evidence in all these countries, which is again recognized by Australia, US, Canada, and Japan. The CE certification was a second priority back at that time due to the long wait list and uncertainties with interpretation of the EU MDR requirements. We also worked on the clinical development strategy with this client. The main study was conducted in Australia, which was an excellent destination for running clinical trials. The data is acceptable in all Tier 1 countries, and the government offers R&D tax incentives for local companies. And let's just recap what the main messages are. So the take-home message is that Australia is indeed an attractive market for medtech companies due to its population size and wealth. The TGA, the local regulator, is fully committed to provide timely access to the latest innovations without any compromise on patient safety and with specific requirements for labeling, advertising, and post-market reporting. And this concludes my presentation. So hopefully you found it useful, and thank you for listening.